Welcome, everyone. We want to let you know you're in the right place with Operation Parent and Dr. Erin Weiner today. We're so excited to help you better understand and for us to learn more about what our teens and children are going through in terms of emotional trauma. So we're loading folks into the queue right now and really excited to have a great large audience with us again today. You might want to take a minute and go ahead and register for our next upcoming webinar. We're super excited about that. It's on October the 4th with Dr. Erin Tirada. She's going to talk with us about teens and eating disorder and the trend of that ticking up during and following COVID at a very concerning rate, but she's going to give us some really great information to be in tune with that and to help the teens that we know and love. So if you go to operationparent.org, that registration for October the 4th is already live. We will hope to have a September program as well. We're just solidifying the final date for that. So stay tuned and hope that you will join us. But go ahead and register for October the 4th and maybe invite a friend or two to that one as well. We want to let you know about our mission. Operation Parent's mission is to love and support parents by providing real-world information, connection, and most importantly, a whole lot of hope. I'm going to take you through the technical components of our webinar. If you're new to Operation Parent and our webinar community, welcome. If you joined us before, you might want to use this time to eat a couple more bites of lunch or maybe go on and register for the webinar. So if you'll go to that orange arrow at the top of your screen and tap on it, that will open up your control panel. We're going to focus on using the question section today. That's about midway down on your control panel. You're going to send both questions and comments there. They're going to come to Nikki and I privately. All questions during or entered there, we're going to do our best to get you a response and get those included in the end of our program and Q&A with Dr. Weiner. We're going to go over 60 minutes with our content today, so just be aware of that. If you're not able to stay on with us the whole time, we totally understand it. I mean, your time is so valuable, and we're very honored that you would choose to spend it with us in the middle of the afternoon. But just know, if we're still continuing with content and you need to hop off, you're going to get the recording, and you can finish up the recording at your convenience later on. We do have the PowerPoint slides that Dr. Weiner put together for us here in the system. You can download right here if you just tap on the handout in the handout section. You can download it and follow along with us. You should have also received an email with the handout included there as well, the reminder email about the webinar. Just remember that that comes to the email that you provided us for registration, so just make sure you're checking the right email if you need to go back and reference that handout later on, or if you're having trouble downloading here in the system, you can go back to that email. So we're trying to give you lots of options to stay engaged and participate today. Now, just reminding you that you will receive the recording after the presentation. You're not going to receive that till tomorrow, though, so give us an opportunity to get it downloaded and then sent back out to you, but you will receive the follow-up recording. If you're live with us, you're also going to get a certificate of participation, so that if you need that professionally, you will have your certificate of participation, or if you are a grandparent or foster parent that may need that continuing education, you'll also have that certificate provided. We will send you a short survey immediately after the close of this presentation. Our audience has been super generous with feedback and continuing encouragement to keep going with these free webinars. So if you have a minute at the close of the webinar, ourselves and Dr. Weiner, we utilize that each time we do a webinar. As you know, Dr. Weiner is a longtime friend of Operation Parent. He has done several webinars with us. He's got many of them included up in our webinar library. So if you weren't aware, we do have a growing webinar library that you might want to reference and check some of his presentations out as well. He's an excellent presenter. He cares so much about people and helping them just be better at prevention and understand what they can learn, what they need to know. He's a trailblazing advocate for prevention. So Dr. Weiner, thank you for being back with us again, and we can't wait to see what we're going to learn from you today.
Oh my goodness, it's always a pleasure, and thank you everybody for coming today for a presentation that's a little outside my normal lane for presenting, but is something that I work with very commonly and that I'm also very passionate about, particularly given where we're going right now in our country and as the school year begins, and that has to do with emotional trauma and how best to handle it as a parent. I've worked with quite a bit of trauma actually in my career. So my main lane has been in addiction, but there is a huge overlap in the Venn diagram between addiction and trauma. And so if you're going to be an addiction specialist, you really need to understand trauma and how to work with it. And so my hope for today is that I can pass some of that along to you, because it's really not imprecise or inaccurate to describe what's going on for young people right now as being emotional trauma for a number of different reasons. And it's something where when you have something like what's going on in their world right now, whether or not it has to do with school shootings or ongoing problems with COVID, everything else, it creates what are called adverse childhood events. And if you attended a previous Operation Parent webinar, I think you've learned a bit about that. And we're going to approach it from a bit of a different angle today, as well as apply that lens to these concerns that so many kids have, and talk about what you as a parent or as a caregiver, what schools can do about how communities can approach it, to really try to give you a solid understanding of the paradigm, and then also what you can do with that understanding. So the objectives specifically we're going to go for today is talk about what trauma is and how it can create thought and feeling loops that stick around, why it seems like when kids struggle with this, it repeats indefinitely, tips to actually deal with the anxiety and stress, how to de-escalate a teen who might be acting out, and the things that you can do right now, because there is actually a lot that you as a parent can do. Children are listening to you, even when it seems like they're not, and they're observing you, even when it seems like they're not. So all that being said, before we dive into the information, one other ask of you. So there's going to be a couple moments today where I'm going to ask for your feedback, and we're going to make it as discussion-y as we can in a webinar. And how we're going to do that is through a resource called menti.com. So if you have a moment, go ahead, either open up a web browser, or you can do this from your phone as well, as if you'd like. Go to menti.com and enter that code 8814-6717. And it should pop up with something that says live polling on it and my name. That means you're in the right place. This number will come back later when I'm asking for your feedback, so this is not the only time to see it. If you get it queued up now, that means you'll be able to respond a little bit more quickly when we get there. So menti.com, 8814-6717. So let's first start by setting the stage of what's going on right now for kids in America, which is that they're under a tremendous stress burden, particularly since this pandemic began in 2020. 46% of parents have reported a new or worsening problem, 20% increase in health insurance claims. The CDC, about 3 months ago now, released a really troubling study that was looking at the increase in depressive symptoms with kids. And they actually found that 44% said that they'd experienced persistent feelings of sadness or hopelessness during the pandemic, and actually 1 in 5 seriously considered attempting suicide, which is just outrageous when you stop to think about it. This was influenced, though, by how connected they felt to others. The isolation was very difficult for them. And so on these graphs, what you're looking at on the left has to do with how close they felt to people in person at school. Did they feel close to them? And the darker bars are the ones where they're feeling closer. And so you can see that those are shorter lines. So basically less depressed if they feel closer. And the same is true for that graph on the right. The darker lines are shorter, and that's for virtually connected. So whether or not they felt virtually connected to others or whether they felt in person connected to others, that helped, but the numbers were still very, very high. There was a meta-analysis that came out about 2 to 3 months ago looking at depression and anxiety over the pandemic, but I want to highlight anxiety here because we just talked about depression. What they found was that 20% of teenagers right now have clinical levels of anxiety, 1 in 5, and that's twice as high as it was pre-pandemic, and it's actually getting worse over time. If you look at these dots in this graph, you can see how as you go up, they're moving further to the right. The newer studies are at the top. So basically, as time passed, kids were getting more and more and more anxious. This is part of what caused the American Academy of Pediatrics to declare an emergency, national emergency in youth mental health. This graph is showing the increase in proportion of kids going to the emergency department for, essentially this is for suicidal thoughts for 2020 over 2019, and this has not gotten better. So a term we have that I mentioned before for these sorts of experiences are adverse childhood events. And the technical definition for this is that these are situations that occur during childhood that provoke a traumatic response. And we'll talk a lot more about what traumatic responses are in a second. But this can be abuse, physical, emotional, or sexual. This can be neglect related, physical or emotional neglect, as well as household challenges like a parent with mental illness, parents being treated violently by partners, divorce, incarcerated relatives, and substance use or misuse in the house. And these are very, very, very common, unfortunately. Actually, 61% of people report having at least one type of an adverse childhood event in their life, and many have a bunch. Actually, this is the large study that first established the presence of ACEs and what they're related to. And you can see here the number of adverse childhood events here on the right, and the number of people who experience them. And you can see that 4 or more, 1 out of 10 people has had 4 or more of those things. Only 36% have experienced none. Women are tend to be a little bit more than men at the highest proportion, or at the highest amount of ACEs. And then here's a breakdown by the different types. And if you look at these numbers, it's actually really, I don't know, it makes me feel sad to look at this. When you look at 28% of kids, if we look at the total between both men and women, these are adults talking retrospectively about what happened when they were kids. But 28% experienced some form of physical abuse, 20% sexual abuse, and you can go down the line, and it's a very significant proportion. So why this matters, aside from the fact that just going through this is something that nobody should have to experience because it's very disruptive, is that ACEs actually lead to a whole host of really negative outcomes in a bunch of different areas in life. We've seen ACEs be negatively, or I guess technically it would be positively related to things like heart disease, stroke, asthma, smoking, being unemployed, having depression. I mean, the list goes on and on and on across all of these different areas. And it's not just a couple people, it's a bunch. Actually, 44% of all depressive disorders in the country could be prevented if ACEs did not exist. That's 21 million cases of depression, COPD, asthma, heavy drinking, I mean, all of this. And you might be asking, well, so how are these things related, right? If I'm watching domestic violence, how does that lead to kidney disease? And we'll talk about that in just a second. You know, take it on faith if you don't know this material already. We'll get there in a second. But the bottom line is we're seeing these very clear, concrete connections. And so when you see this spike in mental health problems amongst kids, and we saw what happened to them in 2020, 2021, and how it's still persisting in many ways, that their world has not entirely just gone back to normal, as here we are, right, with Uvalde happening. I actually personally live 15 minutes away from the Highland Park shooting that happened on the 4th of July. That was very personal and close to me. You know, COVID, BA5 is currently running wild right now in the country. So there's still a lot of things for kids to be worried about. if they are worried about these things. And what we're finding from surveys is that most are. And so I think that there's going to be a case that we can make right now conceptually that will probably be borne out in data empirically in time, that pretty much everybody's getting an adverse childhood event who's a kid right now in the world, but certainly here in our country. Now, that being said, risk factors for high ACE scores in general are kids with caregivers who are or were neglected or abused themselves as children. And that's in part because trauma truly is generational. That's probably a term that you've heard, intergenerational trauma. It's because even if something hurts and feel familiar, those two things are not mutually exclusive at all. And so then when you're put in a similar situation, you might have similar vulnerabilities, and you treat your kids, even if you don't want to sometimes, in the ways that you were treated, or it feels very easy to fall into that. But also caregivers who are young, single parents, or have many children, low education or income level, use corporal punishment for discipline. They are under a high degree of parenting or economic stress, which right now is, again, a vast majority of us in the country. The attitudes that justify violence or aggression, if the caregivers feel that way, like, yeah, you should get slapped around for that, like that sort of, if that's something that you could hear somebody say, that means not that they are committing traumatic events to their children, but it means there's a higher risk that they do versus someone who does not. Community also plays an impact. So communities that have very high violence and crime, poverty and unemployment, access to drugs, and lots of latchkey kids, so basically kids who aren't supervised and who come home, theoretically come home and let themselves in, they are at greater risk for having high ACE scores as well. In general, though, what you're looking at here, the environment that creates these opportunities for ACEs to occur are chaos, instability, danger, and disconnection. And I'd say probably of all of those, the last one is the most common. I'd say for the most people probably who are watching this webinar, not to say that there can't be chaos or danger for anybody, but disconnection is so common right now everywhere in our country. That it knows, no socioeconomic status or race or geographic area. There's a tremendous amount of disconnect, whether or not we're talking about COVID-related disconnect, whether or not we're talking about what's going on with technology right now and kids spending so much time behind their phones. Disconnection creates this environment where ACEs can occur. So let's talk now about how they are harmful, because it's important to know how this all fits together as you're, from a caregiver perspective, or from at the very least a caring adult perspective, to know how to work with it. At their core, ACEs create toxic stress. And when I say toxic stress, that's because there's multiple types of stress. There is actually eustress, which is positive stress, so something that gets you excited, but is actually a positive thing. So getting married, hopefully for most people, is a form of positive or eustressed. There's others like winning an award that can be positive, but do create some amount of tension in your body. Physically, you get activated. There's also then tolerable levels of stress where it's stressful. It's not a positive thing, it's negative, but it's something that you can tolerate. You've got supportive relationships, might be transient, might come and go, but it's not toxic stress. And toxic stress is when you are chronically stressed out and your nervous system, your autonomic nervous system is always activated. The sympathetic nervous system is pumping cortisol, the stress hormone, through your veins. And we're not actually meant to be in basically like a cesspool of stress all the time. That's not how we as organisms are meant to be. But if we are in a situation where we're chronically stressed out, which is where a lot of these ACEs come in, that can create a cascade of problems. And so you've got adverse childhood experiences at the bottom of this pyramid of problems, or you can even go deeper. There's some pyramids that talk about this intergenerational trauma, some systemic factors as well in society. But in this case, if we start at the adverse childhood event, that leads to, because you've got this very activated brain nervous system, disrupted neurodevelopment. We actually see differences in the brains of kids who are stressed out all the time. That leads to social, emotional, and cognitive or thought impairment, which means that they're more likely then to adopt higher risk negative behaviors and can lead to then disease, disability, or social problems. And we do find actually that people with higher ACEs tend to have a shorter lifespan. all of these things, of course, don't have to happen to everybody. It's not to say like, oh goodness, like your parents got divorced, which is a very common thing. Therefore, all the rest of these things are going to occur. But it can put, depending on the circumstances, in any of the adverse childhood event categories, that put someone in a situation of toxic stress. And that's ultimately how that's the mechanism of action. Someone goes through this and then they're tense and stressed, that base level has gone up. And so when we're talking about how do we prevent this progression, that's ultimately what we're looking to get after. How do we resolve the feelings or resolve the situation, help a child carry a burden more easily if they have to carry that burden? If it's not addressed and they just deal with it in ways that are unhealthy, that's part of what leads to the progression up to the top of this pyramid. So I want to highlight probably the most critical element of this chain, which has to do with that activation in the body, which leads to this disruptive neurodevelopment. That's because our brain has basically two parts, and this picture is in like the most anatomically correct picture of the brain that I can find, particularly when it's in stressful moments, and that's of a dog driving a Tesla. And why I think this is such a good representation of our brain is that if we're going to boil it down a bit, but if we boil it down a bit, you can look at your brain in the stressful modes as having two different parts. You have a very advanced, thoughtful, analytical part. That's the car. That's the Tesla. It can do things that a lot of other that all animals, our brain can do things that other animals can't do. We can think abstractly, we can plan ahead, we can imagine things, we could synthesize these big concepts. That our prefrontal cortex is something that has created all these opportunities for us as humans and lets us do a lot of our higher order functions. But as powerful as that is, it is actually not as powerful as our animal brain, our limbic system. That part of our brain is what gets activated when we get stressed out. That's the dog driving our car. And actually what happens when you get activated, and we can see this from fMRI scans, from brain scans, is actually your prefrontal cortex shuts down. And that's why if you've ever been really angry or really scared, it's really hard to like sit back and be thoughtful. And like if you're having an angry verbal argument with someone, you're rarely like, you know what, I'm just going to take a step back right now, even though we've both been yelling our faces off. I'm just going to take a step back and I'm really going to put myself in your shoes and I'm going to think about your vulnerabilities and your emotions and just put your needs first. Doesn't happen, right? Or when you're anxious about something, it's all you can think about. It pops into your head when you're trying to go to sleep, or maybe you try to avoid it at all costs because it's all you can think about unless you're avoiding it. It turns your prefrontal cortex off and it seizes control. And what that part of your brain wants more than anything else, and this is really critical for understanding how and why kids do what they do when they're activated. What this part of your brain wants more than anything else is to not be uncomfortable or in pain anymore. That is its number one objective. It wants to get out of discomfort as quickly as possible. The second thing that it wants is to have pleasurable experiences. That's what our animal mind wants. Definitely get out of discomfort if discomfort exists, and then go find something that makes me feel good. And so what that means is, like, say you've got a kid who's got a test coming up and they're feeling stressed out about it whenever they think about it. Well, when the dog takes the wheel, what the dog says is, you know what makes you feel bad? Thinking about and studying for that test. You know what would feel a lot better? Playing video games for 8 hours until you pass out in your bed with the lights on. That'd feel great. And so they do it, right? Because it's short term, right? And that's part of remember, thinking ahead is that prefrontal cortex. It's short term, but in the short term, it feels better. And that's where a lot of these negative coping styles come from, is it's that part of your brain saying, whoa, 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 I don't want to feel this way. How can I solve this problem as quickly as possible? It's not thinking about the future. And it's an added bonus if doing that thing feels good. Then you're not just taking away a negative, you're adding a positive. Then it's very easy then also to explain away the negative consequences in the future, like say bad grades, like the test was hard, or not think about the sleep deprivation in that example. But that's what that part of our mind does. And we'll talk a little bit more about like specific examples as we go along. But for now, just understanding that when we get uncomfortable Unless we're watching for it, the dog can very easily take the wheel and do whatever it feels is the best idea to quickly get something to go away. That could be lashing out in anger to discharge energy. That could be numbing out with substances or video games. That could be feeling out of control, so wanting to create a sense of control and restricting food intake. We'll talk about eating disorders in a minute. But that's the idea here, is that when you get into this stressful circumstance, unless you've worked on it, the dog takes the wheel. So why it sticks around, though, is another question. So there can be plenty of moments where you go into a stressful circumstance, maybe you'll handle it well, maybe you don't, but then it passes and you feel better. That's not toxic stress. That's more tolerable stress. Toxic stress is stress that sticks around, and it does this for a number of different reasons. One of the biggest ones, though, is that, well, I guess even before I get to this example, maybe the stressor is still there, right? So like if there's something going on in their life and their household and their world that stresses them out and they're not free from it yet, well, it's, they're going to get stressed out again and again and again. So these persistent childhood events that are toxic and traumatic create that. But they also sometimes get triggered when you see a situation that's similar to the traumatic event, and it creates this adrenaline response. The dog takes the wheel. So an example I like to use for this is I call it firemen at a barbecue. And what this means is that firemen know exactly what to do in burning buildings. They come to the house, there's fire and smoke, people inside, they kick down the door, they clear the floors, they get everybody to safety. They've got a routine for that. They know how to handle that dangerous situation. However, when a fireman goes to a barbecue, they don't kick the door in. Even though there is a house, there's fire, there's smoke, there's people. There's all these similar factors. There's a critical difference, right? That the house isn't on fire, but they can see that. So they don't kick the door in at a barbecue. Trauma is like kicking the door in at a barbecue. You see something similar, whether or not it's an authority figure or any germs or someone who makes you think that they could be dangerous, and it triggers these thoughts and these heuristics, ways of viewing the world, shortcuts essentially, and creates this adrenaline response, which then you've got to respond to somehow. And children in particular aren't necessarily good at doing that. Adults, by the way, aren't either. That's where post-traumatic stress disorder comes from. But seeing something similar can re-traumatize you and makes it feel very real and present. That's the biggest difference between a traumatic memory and just a bad memory, is that when someone's been through a trauma, whenever they think about what happened, their body acts like it's going through it again right now. So, like for example, when I was in grad school, my mentor, who I'd worked with for 4 years, suddenly died of a heart attack, and this was really awful for me at the time. I remember going to her wake and just crying, and no one else was crying, and it made it feel even worse for me. But I can talk about that now, and I'm not crying. I also don't feel like crying, and that's because it's a bad memory. It's a memory, but it's not a traumatic memory for me. When someone has a traumatic memory, when they think about it, their body responds as if they're in danger again, and you get that adrenaline right back. What also happens is that avoiding feels really, really important. That's that dog taking the wheel. We don't like to feel stressed and uncomfortable. And so what happens is when we start to get near it, we either consciously or unconsciously are like, whoa, I'm just not going to do that. So like people who don't like to fly on planes will avoid flying on planes, or who don't like social situations will avoid going to parties, because then they get that immediate feeling of relief, which feels good, and they feel like whatever danger they were responding to, like say social danger, is gone. So avoiding starts to feel very important. That can be internal reminders, so trying not to think about what happened, or it can be external ones as well. You can also avoid internal reminders through things like substance use, staying busy, being absorbed in screens, and so on and so forth. So what I want to do now, on the next slide, I'm going to read a scenario to you, and then we're going to switch over to Menti, and that number will be there. But I just like to take a second and put ourselves emotionally in the shoes of a young person who might be going through this, to try to understand, if you're looking at someone who's acting in these ways, where this might be coming from. And we'll do 2 of these examples. So think about what your reaction would be as a child. You have a relatively stable life, but your mother and father, they excuse me, always seem to be working and don't seem interested in spending time with you. You come home from school to an empty house and generally entertain yourself playing video games until your parents come home at around dinner time with takeout. Everyone in the house eats separately and when they feel like it, and usually spends the evening relaxing by themselves in whatever way feels good to them. Your parents almost never come to your soccer games, which is an activity that you are particularly proud of. So let's go over now and talk about how we feel about this. So please, again, go over to Menti. If you're not in there, there's that number again at the top, how to get there. But go ahead, enter in what emotion might this situation evoke in you. And when you hit submit, it should pop up here on screen, and we'll see how you guys feel about this. We're going to make a little word cloud. So yeah, go for the one word answer here. Like what comes up? I think I might have let you put in more than one. Feel free to do that as well. And give us a second. I know we've got a couple or maybe even a few hundred people at this webinar, so we're still in the very beginning stages of getting some feedback. So please do chime in. I'll give us another 20, 30 seconds here. So right now it looks like sad and sadness are coming up for a lot of folks. Lonely is a big one. Abandoned, disconnected, unimportant, distant. Yeah. So like lots of really negative things. Thank you for those who have responded and who are continuing to respond. We'll talk about this, the cloud again in a second. But lots of negative stuff. And why I wanted to lead off with this example is that this is not this is not uncommon necessarily in our society, right? This is pretty normal. And I don't think a lot of times the parents really think about what this communicates over and over and over again, the sorts of feelings that it provokes. It looks like unimportant actually is one of the biggest ones that folks have written as well. Disappointed, angry, so on. Here's the second question that I have for you about this situation. And thanks for all who replied. There's a lot more opportunities to do it. What do your parents' actions say about you? So feel free to write more than one word in for this one. But first we cover the feeling, but like what's the message that this sends? What does it say about you as a kid if this is your experience on a daily basis? You're not important, unwanted, not enough, I don't matter. So as these start to come up, I just want to talk about a theme and then we'll scroll down and look what everybody is writing. So when you ask yourself, how do you stay in situations in toxic stress? A lot of it comes from learning things about who you are, how much you mean. And then people stick oftentimes with these ideas and thoughts for a very long time, many times until they come to therapy. I think I mentioned at the beginning that I'm a practicing therapist, but we oftentimes have to really think about what are the scripts that you have developed and where did they come from? Because if you're hearing, I'm not important, I don't matter, we don't have time for you, you're not important enough to make time, too busy, not loved, not lovable, might be another one in there. I'm a burden, you're not a priority, you're a burden. Yeah. So yeah, I would agree. I would say that that's what it says about you. And I think a lot of times parents don't realize that that's the message that they're sending, but oftentimes when you leave something as ambiguous, if you don't really show kids that they matter, then they don't think that they do. And that's another element. I think I mentioned this in an upcoming slide, but that dog, he doesn't speak English, just like real dogs don't speak English. You can teach them to sit because you reward them when they hear the word sit, but they don't actually understand what the word sit means. And our dog in our brain, our limbic system works the same way. A lot of times when people are having an emotional problem, they try to reason themselves out of it somehow, or like why they shouldn't feel that way. You have to show your limbic system. You have to show the dog that it's safe, not tell it like you're safe. You have to show a child that they're loved. You can't just tell them that they're loved because that doesn't connect to their emotion center. So let's go ahead. I want to look at another one here and then we'll get back to slides. Thank you, everyone who's responding. And please, if you have not responded, and many of you still have not, please feel free to join in the future. So here's our second one. You are afraid of your father. You feel yourself tense up every day before he comes home at about 5:30 because he's almost always angry when he walks in the door. He can't take out his anger at work, so he finds reasons to take it out on you and your younger brother instead. A poor grade, having a mess in your room, there's always something that sets him off and is worse if he's been drinking. You do your best to be perfect to avoid punishment, but you can't really predict which days you're going to get yelled at. And on bad days, you get hit. Your mom doesn't hurt you, but a part of you feels betrayed because she sees what your father does to you and she never steps in to stop him. So let's head back to Menti here. What do your parents' actions say about you? So same question as last time. We're not doing the emotions one. I've got a different follow-up. But go mom, dad, both. What do your parents' actions say about you when this is happening? I'm not loved. And please don't be shy, guys. I think there's still a lot of you who could join in. I'd encourage you to give it a shot. It's fun to be part of the group here. Um, don't care, unloved. They don't want to be around me. It's okay for you to take abuse. Yeah, that's a big one. It's somehow your fault. Yes, we'll actually talk about this one later. I'll highlight this one for a second. This is a big one. When kids oftentimes get this idea from a lot of places in their life, people get what they deserve. And so then they think, okay, well, this is happening to me. I must deserve it. Or, excuse me, I wouldn't be getting hurt or beat if I was better and somehow. They don't love me. I'm a bad person. You are responsible for making your parents happy. So yeah, disconnected, unloved. I'm just someone for to take their anger out. I'm unlovable. Yeah. And this is why, and this is a more intense example, right? Where you're getting hit and then you might feel like your mom either doesn't think you're worth it or just everybody's trapped. I'm an inconvenience. Tells me how important I am in your world. I deserve this. You're responsible. Yeah. So now I want to take this a step further with the next question as we go down this chain. So we start with feelings. Now we're talking about thoughts. So next question for you. How likely do you think it will be that this type of chronic abuse will do these things? Change how much you trust authority figures, teach you that you must be perfect to avoid getting hurt, lower your self-esteem and foster a sense of powerlessness, make you want to feel powerful in other ways when you can. So, just go with your gut. But how much do you strongly agree, strongly disagree? How likely do you think it is that going through that sort of chronic abuse is going to change any of these things? Thanks again for those who are going in. So, I mean, it sounds like for the most part, and you can see the on the curve here as well, but pretty much everybody is responding at a pretty high level on these scales, which makes sense, right? I mean, these are kind of like when you think about the messages that you're sending. If we just stick with this example for a second, my father hurts me and my mom doesn't stand up for me. Um, it's very easy to go for places like, if I can't trust them, who can I trust? Or wanting to control it. Maybe if I'm perfect, I can do it. These are all really common responses to going through trauma. So now imagine for a second that a kid is getting jerked around back and forth, not knowing what to believe about, say, like COVID risk, or they're thinking about feeling powerless about like, well, what's going to stop me from being in a school shooting or in a mass shooting, and feeling just very out of control. Maybe that control is a pretty big one for kids anyway, because there's a lot of things as a kid that you're not in control of. But you start to act it out. You start to try to solve these problems yourself when you don't have a way to talk about it and you don't have a way to understand it. And that ultimately, when we're talking about understanding emotional trauma and then what we can do about it, that's what we're talking about. We need to know how to handle it. Um, as parents. Otherwise, kids take it into their own hands. Thank you, by the way, everyone who responded. We hopefully will have time for one more towards the end of the presentation like this. But for now, we're gonna keep going. So why it sticks around is that you learn these specialized coping behaviors to try to control the situation and create a sense of safety. Because again, when the dog gets worked up, dog wants to get safe and relaxed as quickly as possible. So things that you may see that are in the context of trauma, adaptive, but afterwards maybe less so. Being hyper aware of the emotions or others. What I've noticed is the vast majority of people who just say, well, I'm just a really empathic person. And maybe there are some really empathic people, but usually that's the case because if you weren't very tuned in to someone in your life when you were young, you were going to get hurt. And so you were always watching for those little cues that something was amiss to try to like walk on eggshells and then not get emotionally or physically hurt by them. The need to please or be liked. They might be very conflict avoidant, again, not wanting to get hurt again. They might dissociate, so basically kind of just like tune everything out or avoid stressful situations. They might not trust anybody, but especially authority figures. If they feel like they've been betrayed by those authority figures, they may hoard things, food, money, want to keep things for themselves because they never know if they're going to lose it. They might push people away because it's like putting up a wall. Like if I'm not vulnerable, then I can't get hurt. So I'm going to push you away, or I'm going to keep you at arm's length because that way I'm not going to get hurt by you the way these other people have also hurt me. Perfectionism, because again, if you make a mistake, you might get hurt. They may also self-harm. One of the most common reasons, two reasons that I hear from teens and adults alike for why they self-harm. So this would be like cutting yourself or burning yourself or anything to cause physical pain, is that physical pain basically writes, it masks the emotional pain, and the physical pain is preferable. I'd rather be in pain from this cut than to have to think about my emotional trauma, and I actually feel better. Sometimes they also do it to feel something. And so if someone's just numbed out because they're feeling so traumatized all the time that they just are blank, then by cutting themselves, they feel, and so that's preferable. But they're all a way of trying to solve a problem. So is an eating disorder that's trying to control emotions through food, essentially. You create an emotional state that's positive or remove an emotional state that's negative by doing things with how you're eating. Ultimately, though, the reason why this all sticks around is that when the bad thing doesn't happen, you because of what you're doing, you don't learn that things are safe to begin with. So let me give you an example. Say, for example, that someone is, say you've got a child who is afraid of going to school because of a school shooter. Well, if they don't go to school, then they're never going to actually learn and see through experience, because remember, experience is what teaches the dog in our brain what's safe and what's not. Not rationality, not reason, but experiences. They're never going to see that actually that's still a highly unlikely scenario that it's going to happen in your school, even if it just recently happened in another school, or it could happen in a school. The chances that it's yours are very low. There may also be safety precautions or whatnot that are in place. But if you are just avoiding a situation, you don't get to experience it, and you start to feel like I'm only safe because I don't do this thing. And you can't learn that it's actually safe or safe enough the whole time. So other reasons why it persists, the new information that comes in is something that gets shoved into a way of already thinking that allows this new reasoning to stick around. So examples of this are one that we already talked about. If good things happen to good people, then bad things happen to bad people. This and something bad happened to me, or I'm damaged forever, or I'm unlovable because this happened. Like I'm not okay anymore. I'm different than everybody else. If I was a better kid, this wouldn't have happened. I'm unlovable because of, or I'm a person who does not deserve good things. That's another really common thing I hear from people who have been through some really tough times. It's almost like a way of explaining why this has happened. You'll notice that a lot of this, that it all focuses inwards. We call this in psychology the fundamental attribution error, where you feel like something happening in your world or to you is because of you, as opposed to the environment or other people in your world, which is very oftentimes the case. Of course, we all bring ourselves into the situation, and that matters as well. But a lot of times, it's a lot of it has to do with things that aren't our fault. And when it comes to trauma, the vast majority, if not the entirety of a lot of trauma, is not the person who experiences it. It's not their fault. But it's very easy to want to assume that, and in some ways, because that almost makes her feel like there's this more control over the situation than there actually is. And that is something that's very appealing. This is another one of those uh, the rock in a hard place and you have to choose one. A lot of times people, the idea of not being in control is worse than feeling badly about themselves. And so they'd rather feel in control and bad about themselves than out of control before working on it, of course. And that's, again, a big part of what therapy is about. But ultimately, and I know I've just dropped a lot of ideas on you guys, it's part of why slides are helpful. You can refer back later, but behavior is purpose driven, even if it doesn't seem to make sense. And this is really important. When you see kids who are acting out in negative or antisocial ways, there's a reason for it. It's not just that they're quote unquote bad kids or there's a problem with them. That behavior is serving a purpose. Maybe it's discharging energy, maybe it's creating control, maybe it's redefining a narrative, maybe, I mean, there's a lot of things that it could be doing, but there's a reason, and you need to understand that reason in order to help change it for the child. The dog in our brain doesn't understand language. As I mentioned, the child could have layers of these safety behaviors. The reason why this is important, again, is that you oftentimes can't talk anybody out of anger or fear or any other really stress activating emotion, because it's not a logical thing, it's an emotional thing. You have to speak the language of emotions, which are experiences. But if you have these safety behaviors in place, it's very easy to not actually learn a lesson. So one other quick example to illustrate this, say you've got a child, a very young child who's afraid of the dark because they think there's monsters there. They always go to bed though with a safety security blanket, and they feel like the blanket keeps them safe. Like the blanket gives me a force field, and they know the blanket works because every day they wake up with all their limbs and they're not dead. So clearly this is a monster repelling blanket, right? So safety behavior, they're safe because of the blanket, not because the room's safe the whole time. And that metaphor, the safety blanket, whatever that is, a behavior, a person, there's a lot of different safety behaviors that people have, but that stops you from actually experiencing the safety that you need in order to calm down and release that toxic stress. Safety needs to be shown and felt and not told. So a way to reframe bad behavior, quote unquote, is that they're the tip of the iceberg. So if you think about like the iceberg model, there's a little bit of an iceberg that's on top of the water, but pretty much the whole thing is beneath the surface. That's how behavior works along with emotions. So if you start to see quote unquote bad behavior as a sign that there's something going on underneath the water that you need to figure out, you're going to be a lot better off than if you're just trying to like punish the bad behavior out of a child, because if you're doing that, you're actually missing the point. There's a reason why they're doing it, and that's really important. You want to focus on the why they're doing it, less so the what they're doing. The what they're doing matters, and that might require some, shaping and work on its own, but the why is the critical part. Otherwise, the bad behavior, it's just going to shift to something else because again, it's serving a purpose. This is the difference between self-regulation versus self-control. Self-control is just like a willpower thing. Self-regulation, and this model that you're seeing here on the right, and for the slides we're about to go through quickly, is a part of Stuart Shanker's self-reg model. We'll actually talk about his book later on in the presentation as well, but this is a really great way of framing how do you help a child to regulate themselves when they feel that tension in their body or tension psychologically. How do we release that? And there's 5 different domains where kids can feel stress: the biological, the cognitive, the emotional, the prosocial, and the social. This next section, for the sake of time, we're going to go through quickly, but you've got it in your handout, so please feel free to refer back to it. On the biological side, so you've got a bunch of different possible stressors on the body: sleep, nutrition, motor challenges. And then signs of stress. So if a child is having problems in this domain, they might seem low energy, have trouble changing tasks, have a lot of body somatic problems, get very overwhelmed. For the emotional side of things, there can be a lot of emotional stressors, like having intense emotions in general, or new ones, confusing or emotional events. And this comes out as emotional instability, having strong emotions, and having trouble returning back to an equilibrium after getting worked up. In the cognitive realm, there could be either not seeing a lot of what's around them if they have some sort of sensory issues, but also just too much information too quickly or slowly, basically information overload, deprivation, having to sustain concentration. And this comes out as attention problems, learning difficulties, poor motivation, frustration, and so forth. The social realm has to do with how they interact with others. So interpersonal conflict, confusing situations, signs of stress here, difficulties in groups, making friends and sustaining them, either bullying or being bullied, means that there might be something going on in the social realm. And the pro-social realm has to do with these expectations of being the sort of person that society wants you to be. So added pro-social stressors can be always needing to put others' needs first and not ever having your needs met, having moral ambiguity and not knowing what to do about it, guilt. Signs of stress could be things like lack of empathy, being overwhelmed by dominant personalities, feeling anxious or isolated in groups. Again, a lot here to think about and look at, and we could, have entire day workshops on this theory alone. But the main idea that I want to convey to you here, aside from giving you this to look at later, is that if a child is burning all of their energy in with existing stressors in any of those 5 domains, they're not going to have anything left to process new ones. And that's ultimately what we're seeing with a lot of kids these days, is that they're dealing with so much stress in all these different areas that then when you plop something else on top of it, like a problem at school or a conflict at home, anything, again, in those 5 domains, there's no energy left to deal with it. And that's where the ACEs come in, because that's that toxic stress, that level. Like if you're already at like a 9 out of 10 all the time, it's only going to take 2 more units of stress to push you over your top. So that brings us to a really important element here about how can we create the safety? What do we do about it? How do we help? And so I want to talk about some actionable steps that caregivers can take today, if you want to work with your kids, or if you are not a parent yourself, but are in a situation where you're interacting with kids, you can use it with them as well. So the number one most important thing that as a caregiver you need to be able to do is know the signs of when someone possibly might be going through or has had an adverse childhood event. So what you want to look for here are a number of different signs of emotional distress, which you can categorize either as internalizing symptoms or externalizing symptoms. Internalizing symptoms are things that are symptoms that are, you can kind of imagine it like kids are folding in on themselves and they're not letting it out. Externalizing is when they take that energy and they discharge it. So internalizing can involve things like academic problems, difficulty sleeping, difficulty concentrating, shutting down, social withdrawals, those body somatic problems, spending lots of time in social media or games, and then self-harming behaviors. This is, again, all this energy, but kind of just folding in on yourself, or in the case of a self-harming behavior, like trying to let it out in that way. Externalizing can come across as moodiness or defiance, alcohol and drug use, extreme sensitivity to criticism. That one is because if you're already thinking something negative about yourself and then someone else says it, like it's manifested in the real world, that feels really threatening. And that's this goes for adults too. A high level of physiological arousal and a startle reflex. So like you tap someone on the shoulder and they really like jump, or they get really angry when you surprise them. That can sometimes be because they're feeling danger, like there's danger, or they're on edge all the time anyway. And so being surprised kind of pushes into that raw spot. Reckless or self-destructive behavior, and then certainly violence or just acting out in general, is they've got all this tension inside in there and they're letting it out. Specific concerns that you can watch for as well. On the depression side of things, you're looking for negative comments and expectancies, statements of them just outright saying that they don't really value themselves very much, not enjoying normally pleasurable activities that they normally would like to do, or crying all the time. There's a couple suicidal indicators that I want to put out here because this is also a lot more common for people with more higher levels of ACEs, is thoughts, statements, or writing about death or suicide, and then speaking positively about the impact of death. So it's not atypical for teens to think about mortality or to, just entertain a thought, but it's very different when they're actually verbalizing it or writing about it. And certainly if they're saying things like, things would be better if I'm gone for you or for me, everyone would be happier this way. Those are definitely signs to take very, very seriously. Additionally, if they give away valued items, that's not normal at all for a child. One more to watch for here is if you know there's a child who's been struggling with depression and then all of a sudden they seem a lot better, that can also be a warning sign, because sometimes when someone's like committed to the idea, like they decided I'm going to kill myself, there's a sense of relief where they're like, okay, this is going to be over soon. So if you see a really abrupt turnaround, just something to be, maybe someone got a lot better, but also it's worth paying attention to make sure that it's not more like they know their life is about to end, and so they're feeling less depressed as a result. On the anxiety front, things to watch for is just a general sense of overwhelm, avoiding certain activities or groups, and then panic attacks. Each of these categories, of course, we could dive really quickly into. I'm just trying to start you guys today with the most important and visible symptoms, particularly when you combine them with that list on the last slide of internalizing and externalizing symptoms. On the eating disorders front, we're looking at things like preoccupation with food or weight and a body dissatisfaction. I believe it's right now about 80% girls versus 20% boys who have eating disorders, but 20% of people with eating disorders are boys and men, so definitely worth keeping an eye on that as well, regardless of the sex or gender of your child. There's an emphasis oftentimes on control in someone's life if they're having an eating disorder. They may skip meals or have excessive ones, experience weight change or binges. They might leave right after meals. If someone is vomiting, if they're purging, they oftentimes do that right after a meal. They may also spend excessive time in the bathroom. Another sign of someone vomiting a lot can be enamel erosion in cavities, teeth. So quick plug, and I think Michelle mentioned this at the beginning, my good friend, Dr. Erin Terada, will be doing a webinar on this next month. So she knows far more about eating disorders than I do. She's a fantastic presenter. So please register for that. I know I always learn something every time I hear her speak as well. So swing back for that one. But again, really high level for today. These are things to watch for. On the substance use front, things to watch for here are potentially a decline in hygiene, burns on the fingers or lips, dilated or red eyes. And this can be for both. This is not necessarily for just really hard drugs like opioids, but this can be for vaping, which is what you're seeing there on the right, vaping THC as well. So vaping marijuana or cannabis. Long sleeves in warm weather can hide a vape pen, which is by far right now the most popular way that kids are taking in nicotine and THC, which is the active component in marijuana. It can also hide injection marks if you have a young person who's using injection drugs. You might notice a child who's struggling with substance use see their wardrobe change because they're trying to fit into a different subculture. Kids communicate with their clothes a lot. And so if it seems like there's been a wardrobe shift or that they're trying to identify with a community that's really closely linked with drugs, that's worth keeping an eye on. If you've got a child with either too much or too little money, it might be because either they're spending their money on drugs or alcohol or they're dealing. You'd be surprised at how many small-time drug dealers there are in schools. A lot more kids do this than parents think that they do. That's part of how drugs are in schools, is that kids resell them in there. So if you have, if your child seems to have like items or money that they shouldn't have, worth looking into that as well. Secretive phone calls, changes in sleep habits or energy, often asking to go to the bathroom. Munchies or sudden appetite is a sign of potential marijuana use. And if it seems like they're trying to mask the smell in some way as well. So again, a lot of information I know in a limited amount of time. Please feel free to refer back if you'd like, or drop me a line. You're welcome to email me after the presentation if you'd like. But all right, so knowing the signs is the first step. The second is be safe to talk to, including about difficulties and failures. The acronym that I love for this, no pun intended, is communicate with love. This is from, I didn't make this up, this is from the Center for Motivation and Change. But this stands for listening, offering, validating, and empathizing. And for those who are at the webinar today who know motivational interviewing, this should sound very familiar, but a lot of this comes straight out of our therapist's playbook, hashtag motivational interviewing tips. But listening specifically is open-ended questions. You need to listen actively. People can't tell that you're listening unless you show them. And so ways you can do that are with open-ended questions and reflections. An open-ended question is a question that someone can't answer with a quick yes or no. So it would be the difference between saying, did you have a good day at school? Versus, what was the most interesting thing that happened at school today? Or tell me about something that challenged you at school. That is not a yes or no question. Open-ended questions tend to start with what or how or tell me more about. Sometimes why, although you got to be careful about why. Sometimes that can come across as like accusational. But asking in ways that show that you care, or follow-up questions that show that you care about a lengthier response, is a great way to encourage someone to talk more, but also to show that you're listening. Reflections are when you just take what someone tells you and then give it back to them in different words so that they can tell that you were listening. You can either reflect back content or you can reflect back an emotion. So for example, if you've got a kid in your car who's saying like, oh man, like I studied so much for that geometry test, but I still got a C. That if you respond by saying something like, oh, that's so frustrating, putting in all that work and having it not pay off, oh, I can't imagine how you're feeling right now. That is a reflection, right? They didn't say they were frustrated, but you picked up on that and you showed that you were listening. So active listening, really important. For offering, this has to do with how you offer advice. And a lot of times parents fall into a trap of being very just authoritarian and saying like, here's what you need to do, and being very directive about it. The problem though, and this goes for kids and adults alike, is that when you push on someone, they can push back. And that's where people get into power struggles or defensiveness and back and forth in relationships. If you push, people can push back. If you don't push, then, or you're not pushing, then someone doesn't have anything to push against. So how this works and how to offer guidance without pushing is using something called a feedback sandwich, where you sandwich the advice or the guidance between two opportunities for the person to show agency. So what this looks like is the first slice of bread is asking them permission, saying, hey, I have some thoughts about how you can handle this. Do you mind if I share them? Or would you like to hear them? And then when they say, sure, go ahead, then they've actually asked for the advice. They've given you consent. And that means that, again, you're not pushing. They've literally asked for it themselves. And so then you provide the information. And then afterwards you ask, what do you think about that? You could even explicitly say, it's totally okay if you disagree with me. That's totally fine. And that gives them another opportunity to parse it, talk about it, decide if they want to take it or not. What we found through research is that when you do the feedback sandwich approach, people are far more likely to actually take your suggestion and do it because they feel like it's in some ways their idea. They asked for the guidance and then they decided if they were going to take it. And you'll get a lot less pushback as well. So that's the O, offering. Validating reinforces self-efficacy and self-trust. So this is just letting somebody know that their feelings are valid. You don't have to agree with them even necessarily, but just taking a minute to let them know that their gut isn't totally off base. It feels really good, and it's very similar also to empathy. Being, to borrow Brene Brown's term, be in the hole with them. Get down with someone when they're having a hard time. Don't just like go in there white knight style and try to fix it. Like actually feel what they're feeling, show them that you can understand them, and then when they're ready, do that feedback sandwich, right? And help them out. Now, the big thing here is that if you don't have a great relationship with somebody, have persistence, don't get discouraged. Remember, safety has to be shown and not told. You can't say, it's okay for you to talk to me about this. You have to show them that it's okay for you to talk to you about this over time. They have to see that it's safe, not hear that it's safe. So if you keep this up and you show someone that you care about them, that you're listening, that you're a safe person to talk to, they will eventually work more with you. Now, in terms of modern traumas, and these are things like school shootings, mass shootings, talking about COVID, if there's something politically upsetting, because I feel like we go from one big major political issue right now in this country to another, how do you talk to them about this? And so I want to give you guys a few tips you can work with today around this specifically. So first, be aware of your own reactions and be in a stable state of mind. This is really important because kids pick up on the energy we give out. So if this isn't something that we're ready to talk about as adults, we need to get there first, get our dog under control, right? If we're struggling with that and our physiology is elevated, like make sure you're in a good place to talk about it, then engage with your child. Create that safety because they're feeling what you're feeling. First, then ask them what their thoughts, feelings, and concerns are. What have you heard and how are you feeling is a great thing to ask, right? So start with them. First, listen, then talk, right? Because you don't want to guide them to what they think they're supposed to say. You want to hear what they have to say first. There might be, you might assume you know what they're thinking, but you very well could be wrong. So ask them first. Make sure to be honest and talk about all sides of an issue. So a lot of times around difficult subjects, it's very easy to just paint like an overly optimistic or Pollyanna-ish way of looking at something. Kids see right through that, particularly teenagers. They know when you're trying to just make it seem okay. It's worth talking about all sides of an issue rather than just doing one side. And don't feel like you need to talk about everything all at once. It doesn't have to just be one conversation. Maybe it would even be better to talk about it more than once if there's different feelings that come up over time. And it's totally okay if the discussion upsets them because it's an upsetting topic. You know, it's okay to feel what you're feeling. That gets back to that validation part of the love model. You can normalize those emotional reactions, maybe even talk about yours. And lastly, getting back to that consent bit, it's okay if they don't want to talk to you immediately. Just let them know that the door is open. There may come a time where you really do need to talk about it, but if that can wait, then again, them having choice and autonomy is really helpful. So this is what I'm calling step one, release. So basically help them let the energy out. If they're holding it inside, express it in a healthy way. Step two then is refocusing. So how do you help them use that energy in a productive rather than destructive way? So this can include things like discuss what risk actually means. Because a lot of times when something's just happened, it can feel like it's definitely going to happen again, or like the risk of it happening again is really high, when in fact it's still really low. And you know that's part of how like speed limits work. You know, like there's greater risks at higher speeds, but it doesn't mean that if you're driving 60 miles an hour on a highway, you're going to get into an accident. And then really focus on what you can control to reduce risk. If you haven't heard of The 7 Habits of Highly Effective People, great book worth reading. This is Stephen Covey's model here. But if you focus on your circle of influence, which is what you can control, versus your circle of concern, which are things that you care about but you can't control, the circle of influence sits inside the circle of concern. If you work only on what you can control, what you find is that you get more influence. Your ability to control what you need to control actually grows. Whereas if you spend all your energy thinking about things you can't control, you'll find that your ability to control things actually even gets smaller because now you're dealing with anxiety and other things. So focus on what you can control to reduce risk because there's plenty of things that we can't control about the things that are going on right now in our social ecosystem. Create or reflect on learning experiences rather than just the ideas. So this means give kids an opportunity to experience the safety. This is again saying that the car part matters, right? You do, talking matters, but a lot of times when it comes to anxiety and trauma, the experiences and the emotions matter even more. Make sure you limit doom scrolling as much as you can for the kids. I know it's hard with the devices and the time they have on their hands alone with them, but doom scrolling is when you're just constantly like looking through news or social media, reading about all the bad stuff that's happening in the world. That's a term actually that it got coined in 2020, but it's something that persists to this day. There's always places to find bad news if you're looking for it, and so really trying to not immerse yourself in that is very helpful. You can also suggest productive, pro-social, and proactive ways to use that energy to make things better. You might not be able to cover everything, but you can cover some things at least. And so trying to redirect that energy in a way where a child can have a greater sense of control over what they can control is very helpful. So we're going to get back to the list of steps for caregivers. I want to acknowledge we're about 2 minutes away, or actually no, I think I've got a little bit more, about 8 minutes away from that 75-minute mark in our webinar. So I'm going to try to get through everything by that time. If I bleed over a little bit into question time, I apologize in advance, or maybe Michelle and Nikki will come in and give me the hook or something. We'll see, but I'm going to try to fit it in the 8 minutes as well. You want to create resiliency through healthy connection and healthy connections. And what does this mean? These are things like first connecting with your family. So being a part of the household and not apart from the household. This might mean for you as parents actually like going to where your kids are and learning to play a video game, or talking to them about what they care about and watching their movies and their shows sometimes. It's very hard to connect with someone when you don't show interest in anything they care about. So it doesn't mean that you can't also do your things, but like if all you're asking your child to do with you are like the chores and go apple picking, that might not be what they actually care about and might not create the connection that you actually want. So positive, healthy in-person connections are really important. Parents, peers, and then also caring adults who can serve as role models. In the model of ACEs prevention in particular, this is huge, particularly if you're working with a child who has gone through traumatic experiences with parents or previous parents, or in certain situations, making sure they have people to look up to who will guide them in a positive pro-social direction, really important. Stable and safe childcare, if that's something that you need as a parent of a young child or as a teenager. And then safe and engaging after school activities. We know that the more kids are just left to their own devices and are kind of like out, quote unquote, running in the streets, if you will, that's where they tend to have more of these negative experiences. So giving them safe places to go is really important. You can also enhance behavioral and emotional connection and awareness. So on the behavioral side, knowing the difference between a traumatic response versus a here and now response. So if someone is having a really emotionally flagrant reaction to a situation that probably doesn't warrant it, that might be because it's tapping into something in the past. That's almost always how it works, by the way. The same goes true in like couples counseling. Like if someone's having a really intense reaction to you like being, say, like 15 minutes late for something, it's probably not because you were 15 minutes late. It's probably because that's communicating that like you don't value them or their time, or you don't respect them, which like is a huge trigger button. Remember those narratives we were talking about before, that when they get reinforced, get a strong reaction. This shows up for everybody, not just for teens. But when you go through something like that, it's important internally, though, to know that that's why that's happening. Oh, wow, like I'm having a super strong response to someone being 15 minutes late. Maybe actually like they shouldn't have been late, but there's something I'm bringing to the table as well. So a child being able to have that awareness is huge. Them also knowing about how safety behaviors and avoidance work and then not doing them is critical to working through anxiety. So if you haven't mapped that out, if young people aren't working on that, if they're dealing with anxiety, that's one of the necessary steps to being able to resolve it. Because again, if you think you're safe because of your safety behavior, you can't learn that your environment has actually been safe the whole time. Conduct yourself with self-respect to raise your own self-esteem. This is huge. A lot of times people, particularly if they're struggling, treat themselves far worse and judge themselves far worse than they would anybody else literally in the world. And although I'd say that the latter one of people just judging themselves really harshly is pretty common, for most people it's not like malignant. It's not like making it so that you have really low self-esteem and can't function. But if it is, whether or not you're a teenager or an adult, one of the first steps you can take is start acting and treating yourself like you are someone worthy of love and respect, and let that flow into the rest of what you do. On the emotional side, being unable to actually identify and express emotions is one of the biggest reasons why they start coming out in those unhealthy ways, like eating disorders, substances, self-harm. So helping build that knowledge, it's really important. So next on the list, you can promote the development of healthy coping behaviors. Starting with your physical health, everything is harder if our bodies aren't right. So this is things like sleep, exercise, nutrition, screen time limits. And then deep breathing and mindfulness is really, really helpful. I was hoping to have time for an exercise. I'm going to have to skip it for today, but I do want to introduce this. Deep breathing is one of the best possible things that you could do for anxiety and stress because it actually sends a signal to your brain that you're okay. And it activates your parasympathetic nervous system and physiologically calms you down. I actually have a YouTube video on my channel if you head over there with instructions about how to do diaphragmatic breathing. So feel free to head over there into like the lessons and meditation section if you'd like. But basically you breathe in through your nose all the way down into your belly, and that's the big part. Your shoulders should not move. You let it out then through your mouth. This activates the parasympathetic nervous system, and a technique you could do called box breathing or four square breathing is you breathe like this in a controlled way. You breathe in for a count of 4, you hold it for a count of 4, you exhale over a count of 4, and you wait for a count of 4. And then you do that for 4 minutes. And if you were feeling at all stressed today, give this a shot. I think when your 4 minutes is up, and just set a gentle, not jangly alarm to let you know when it's done so you don't have to think about that. I think you will find that you feel a lot better than you started because you're just basically using your body to your advantage. Mindfulness meditation is something you can build on top of breathing, where meditation is like going to the gym for your mind. A lot of people, when they think about meditation, they think it's about clearing their mind. It's not really. It's about watching your mind. That's what mindfulness is about. It's about noticing your thoughts so you realize that you're not them. Funny little comment about warrior pose, but being able to notice it's not a problem actually that she's having these thoughts. The problem is if she gets lost in them and doesn't return back to her breath before getting lost again and come back to your breath. You don't start as an expert with this. You do have to practice it. It has immediate benefits and long-term benefits. So again, it's just about focusing on your breath, but you watch your mind, you catch yourself drifting, and then you begin again focusing on your breath for as long as you're meditating. That's really all it's about. I'll have a couple app suggestions in a minute that's helpful. So again, we're going to do again lightning round right now, guys, just to make sure we have some time for questions. But do download the handout so you've got this, and feel free to email me later. When you're calming an activated teen, the first thing that you want to do is help them identify and name what they're feeling. Sometimes they might not know, but even just when you name an emotion, it's very helpful in terms of resolving it. After that, though, you want to first calm the body down first, then the mind, because again, when the limbic system is activated, when the dog has the wheel, you're not thinking. So calm the body down, then the mind. For the body side, diaphragmatic breathing, really helpful. Exercise can also work, getting out in nature, and cultivating the skill of mindfulness. The next step after, and it's much easier if you practice this de-escalation in the body at less stressful times. After that, use the love tactics to discuss the underlying thoughts and feelings that led to them getting activated and model problem solving with them. Anger and upset, often a big part of feeling helpless and stuck. And so you can also talk with them about what happens with the unhelpful activated behaviors versus more helpful ones as well. So last one here, you can explore those self-regulation domains from that self-reg model that I mentioned, and I'll give you a resource for that in a second, as well as work with a therapist. We don't bite. If you've learned something today on the webinar, that's because I learned it somewhere else. None of these ideas here today are mine. I didn't come up with them. So we train for a really long time. It does not mean you're a bad parent if your child could use help from a therapist. I think that's a big barrier why a lot of parents don't do it. It's totally worth it if your child is really struggling, or if you try some of these things and they don't work. So again, lightning round, last few things I want to talk about today. Focus on rewarding positive behavior rather than just punishing poor behavior. Reinforcing the things you want to see happen again is critical. If all you do is punish bad behavior, you're not giving them where they actually need to go. So give them positive rewards for things you want to see them do again. Be consistent with positive and negative consequences. That's really important for learning. Be on the same page as your parenting partner. You can't be sending mixed messages or it causes a lot of problems. Take care of yourself and your marriage if you are married. As household leaders, you set the tone. And if your emotional or relational health suffers, it flows down to the kids. They pick up on this. So it's worth taking care of yourself. And I guess just as a quick kudos to you, just showing up here today is a positive step, wanting to learn. So really quickly, I do have a slide here on what schools can do. And again, I'm just going to put this up here because I know it might not apply to everybody and we're out of time. But there are things that as a teacher that you can do to help the kids in your class. There's things as a school that you can do to help support your teachers and give them the resources they need to handle kids who are struggling with ACEs. There's also a really robust community strategy model that's been released by the CDC. I recommend downloading it or reach out to me if you can't find it. They've got those 6 pillars there on the right with the strategies that can help prevent ACEs, and then the approaches specifically that you can do. The questions to ask yourself if you are part of a group that might want to do this is, where can you find the most support to make this a success? Make sure that you emphasize the actionable over the symbolic. So actually get out there and do things that make a tangible difference first. And smaller scope with higher efficacy is okay. Do what you can actually do and be efficacious at. Don't worry about it being everything all at once. So final couple recommendations here. For apps, if you're looking to build mindfulness skill, particularly in kids, I love the app Headspace for this. The other one that I'd recommend that can be very helpful is 10% Happier, but for kids in particular, I think Headspace does a great job. The 5-Minute Journal is the name of the app that has that icon. That's a positive psychology journal, really easy to do, helps cultivate some gratefulness and positive psychology interventions that have been shown to help with creating a more sustainable place of less toxic stress. And then lastly, Happify is a cognitive behavioral therapy app that gamifies the process of doing healthy things for yourself. So just something to look into if you'd like to try something at home. You're not necessarily looking to work with a professional. A few books to look at. This is that self-read book, Reg book by Dr. Shanker with the model that we spoke about earlier. Unwinding Anxiety. This might not be quite as approachable for teens, although it's very easy to read, but it is the best book that I have read in a long time about how anxiety works and very easy actionable steps in terms of making it better. Permission to Feel is a brilliant book by Dr. Mark Beckett about emotional intelligence, and is a really critical skill to cultivate in kids, particularly who are dealing with ACEs. And then lastly, a book on mindfulness written for teens that's very good is this one, Mindfulness for Teens in 10 Minutes a Day. Also, feel free to pick up the Operation Parent Handbook. They sent me a copy. It is marvelous. I can vouch for it. There's just a ton of really good information in there that they can talk to you a bit more about, but it's definitely worth picking one up if you get a lot out of their webinars. So all that being said, take homes, and then we are on to questions. Our children need our help right now more than ever. There's a lot of stress going on in the world. There has been a mental health emergency declared by a bunch of federal and national agencies. They really need us. ACEs are common, I'd say very much so now, more so than before, and have significant consequences, but these consequences are not inevitable. That's why we're talking today. There's things that you can do. Traumatic situations leave memories that cause adrenaline responses and teach lessons that are not accurate. That's how trauma works. You've got these thoughts that they can cycle back up and get you feeling just like you were before and cause those problems. And so working kids through that is really important. Traumas cause their damage through toxic stress, so you want to alleviate the stress and teach self-regulation. That's what mitigates the damage. Consistently safe relationships and environments are essential, and you can start at home teaching these coping skills. It does not have to be just from professionals, but don't be afraid to reach out for help if you need it. That's what we are here for. So thank you guys so much for your time and attention and for staying to this point. There's my contact if you need to get a hold of me, Aaron@weinerphd.com, and that's my website where you can find me. So thank you guys again. I know I was just talking your ear off for like 90 minutes straight practically, but I'm happy to take some questions now if we have them. Michelle, I
Thank you
think you're
so
still muted
much.
there.
I got it. Thank you so much. That was amazing. So good. While we're pulling up our, we're going to go through a couple of Operation Parent slides, but we did get a couple questions in the meantime. One of them is it pretty typical for teens that are experiencing eating disorders to wear baggy clothes? Is that the case, or not always the case, or do you have a feeling one way or the other there?
So I don't know the statistics, but I definitely have seen it and think it's fairly common. There's oftentimes a lot of dissatisfaction with the body for people who have eating disorders. And so wearing baggy clothes is a way to hide it. They may also find that comments they get about their weight, if people are concerned, they don't want to hear it. And so by wearing baggy clothes, they don't have to face that sort of concern as well. So,
Sure,
yeah.
sure. Um, Another viewer mentioned a resource as or something to further study the epigenetic trauma by Jane
Mm,
Osman, that theory. So the theory that trauma can leave a chemical mark on a person's genes, which is then passed down to future generations. So if you have an interest in multi-generational trauma, that might be a good resource for folks to check out. The last name is spelled Ausmen, Jane Osman's theory. And then also someone mentioned natural disasters being another layer of trauma
mm,
that many of our teens are experiencing heavily on top of everything else you just mentioned. I know here in the state of Kentucky, we had a massive tornado that hit Mayfield, Kentucky area and the Bowling Green area. And then just this past week, we were deeply flooded in the eastern Kentucky region, the Appalachian area. Um, and Letcher County was hit really hard too. And we have over 37 people that, and they're still in the middle of that crisis that have died. And we're still in the middle of that crisis. So when you overlay natural disasters on top of everything else that teens are up against, yeah, and I guess that's a very specific deep trauma. Do you have any thoughts about
yeah.
resources for that, or?
Mm. So that's a good question. I don't know as much, admittedly, about like natural disasters specifically, but it definitely pushes on a lot of the themes that we've talked about today, of things not being controllable, or like I just even thinking about,
Mhm.
um, I mentioned I was 15 minutes away from the Highland Park shooting, and I know that for many people who were in the parade or who were nearby, even though it was perpetrated by a person, it almost felt like a natural disaster because it's like, well, what can you do?
Yes,
Like this is,
yes.
this is just something right now that's happening in our society, and so there's an element of uncontrollability about it. I know actually that the FBI sent a disaster response team with therapists and things to help with that, and I'm sure that there are a lot of resources for people going through natural disasters, but just trying to come to terms essentially emotionally with the fact that there's parts of life that we just simply can't control, and then not generalize that out to parts of life that we can control, or recognize that if you're having really strong feelings about the natural disaster, that that's okay, but that also you do need to express them and let them pass through you rather than stuff them down and let them basically it starts to rot essentially when you stuff down bad feelings. It's like sweeping food under the rug that eventually starts to smell. Like you've got to let the emotions out.
Definitely. And I know that you were deeply impacted by that shooting, and it's so close to you and affected family and friends of you personally. And so I'm so sorry about that. And I'm so thankful you were willing to loop back around and help other folks think about how that kind of trauma is hitting the news. And I can't imagine how heavy that was on your local news.
So
Hearing it
many,
over
yeah,
and over again is really hard too, and that will go on for quite some time, I'm sure. So
yeah, yeah.
thank you for being willing to share that with us. Um, so we're going to keep an eye here. If you have not submitted a question you're interested, I have a couple of slides I'm going to talk through, and then I'm going to pop back into the question box and hopefully take a couple of closing questions. We do have a special offer here today. We want to let you know also we have a new elementary handbook. So it's hot off the press. If you may have only heard about it if you were on our last webinar last week, but it is the updated standard edition is now available for elementary handbook. And then very soon, we are currently in the updating phases for our Spanish as well as our Christian edition. So if you're here with us live on the webinar, you have access to a very special offer, which is 15% off of any quantity. If you wanted to make a bulk order on our handbook, the code you need to use is 15 back to school. So because we're already there at back to school time, the summer has left the building. So 15 back to school will get you 15% off an individual handbook or a bulk order. And that offer ends very quickly on August the 9th. So hopefully, if you haven't checked out our handbooks yet, you would consider going over to operationparent.org/shop. And then again, that webinar registration for Dr. Terada is alive, and that's going to be October the 4th at 4 o'clock. Yes, someone did remind us that American Red Cross would probably have some really great resources for natural disaster support. Thank you for that reminder. It's awesome. Someone says, excellent webinar. The suggestions and resources for anxiety, self-care, schools are all extremely helpful. So,
Well, thank you.
very good. Okay, it's looking like okay, I'm going to try my best to honor this question. How to help an individual teen who is still experiencing trauma. And I think maybe they mean, and also posting about it on social media. But I might, if I've not gotten that question right, feel free to recomment. So any
How to
advice
support a teen
who is dealing with trauma and maybe also, I guess, maybe
Hmm.
publicly putting it out there on social media.
Hmm. Well, so I guess first thought is that if they're currently still going through a traumatic situation, then that might need to be reported to like DCFS if that's appropriate. Just want to start there. But if we're talking about dealing with symptoms of traumatic stress and they're posting about that on social media, it's always tough to say. I think really one of the biggest misconceptions I think that people who have gone through a trauma have is that their symptoms can't go away, whether or not it's nightmares or reactivity, difficulty with authority, difficulty with crowds. I mean, the list goes on, but people just feel like, okay, well, this is just the way that I am, or this is the only way to view these situations. And it's not, actually. I mean, I've been treating trauma for almost a decade now, of all types, and there's 3 different therapies we have that have about an 85% success rate at getting all these symptoms like well under clinical levels. And so I think the most important thing is just for people to understand that there's actual solutions that don't involve drugs and alcohol and all the other destructives or just numbing out or avoidance. Like you can actually solve the problem and hooking them into care.
Oh man, that's exciting to think about the resources and progress. Are there any like national organizations that you gravitate toward just in terms of healing? Like, are there some other? I know you've given us a lot of resources already, but I wondered, kind of flipping that posting on social media in a negative light, if there's anything that you're liking on social media that might help a teen to have some positive messaging and hope and support.
That's a really good question. So I don't have anything off the top of my head of just like a channel to plug into with like really good information. I know that a lot of people are getting some of that these days from social media though, that there are like I'm not familiar with where those places are, who's good and who's not, but there's definitely a trend of people hopping on like of all places to TikTok to find like therapy advice and those sorts of like it's all over the place. I wish I had a good suggestion, but I don't.
Okay, I'm trying to come up with one as well, and I'm blanking. So if anybody's watching has a good idea, I will say it's not related directly to trauma, but there's a group, Media Girls, out of the New York area that has just positive social media thoughts and comments and like how to be a good consumer of social media and think strategically about what you're seeing out there and what's good for you and what's not. So that might be not on the trauma note specifically, but some folks might be interested in checking them out. I don't know them deeply, but I've come across a few things that I like. Um, okay, I think we've gotten through the questions that I can see. Nikki has been awesome help with us on all the technical components of the webinar and an awesome team member all around. Nikki, I didn't know if you might see a question or two.
Yeah, I do. I see one. And I think this was Dr. Weiner after you talked about some media overexposure after traumatic events. This person says, why does the media talk over and over about the same traumatic events? I understand people needing to know, but sometimes enough is enough.
Yeah. Well, I think it has to do with the fact that the media exists to sell advertisements, and so if you have a, I guess just being a little cynical about it, but if you have a topic that everyone wants to hear and know, and it feeds into, you know, either intrigue or insecurities. I mean, I think we could think about plenty of news stories over the past year that got blown up to a national level that probably didn't deserve it, but were kind of like, you know, clickbaity. So when you come across something that actually is very concerning and that you know, it's in their financial interest to do that. I think, you know, once upon a time it had to do with just like resetting the news every hour so that someone just tuning in would get it. But these days, I think it's just more about like, how do we get people to keep coming back to our website or keep watching? I know, kind of cynical, but that's just my take.
No, that's really good. And I have one more. It says if with back to school, I believe, if my child is not asking about school shooting or school shooting drills, should I still take a note to talk to them about it?
So I would say yes, definitely. So something I talk about a bit when I'm getting more at media specifically and like shows that your kids might very well watch, but you haven't talked to them about is that they get to create a narrative on their own or with their friends if you don't talk with them about it first. And so if they're going and they're having these experiences and they're not talking to you about it, then you have no idea what they're thinking or not thinking, or the conclusions that they're coming to, and they may be really insecure about it and not mention it, whereas having a conversation would resolve it, or talking about it ahead of time. I've talked to plenty of people who have been through school shooter drills and had that been very emotionally jarring for them in lasting ways. And I think sometimes, you know, having a better preamble to that, preparing people for the experience, might soften the blow of having to act as if there's a shooter in the building. So yeah, I guess the answer to that question would be yes, I would do it. I would, but it doesn't necessarily have to be a big conversation, kind of like we talked about. Just open the door and say, hey, so like this happened, and we're going back to school, and we haven't talked about this before, and just wanted to get your thoughts about how you feel about it. You know, open-ended question. I give them the opportunity to say no if they want to say no, but just let them know the door is open. I think that would be a really good idea.
Oh, that's so good. So
Good.
opening up with some conversations, you know, at home even before they go to anticipate. You know, there's quite a few drills in the beginning of the year, and especially if you're really little, those can all be really scary, I think.
Yeah, like if you think your school, you know, you never even thought about the idea of someone roaming the halls with a gun, and then all of a sudden, like you're going through this drill where you're hiding under a table and told not to come to the door if somebody knocks. You know, like that's really really super jarring. So
Yeah.
yeah, talking about it ahead of time is a great idea.
All right, this has been awesome. Really great time together this afternoon. We've learned even more from you this time as we learn more each time. So we thank you for continuing to stick with us and always being a great presenter, co-presenter, and we thank you so much. So everybody, we look forward to seeing you next time on our next webinar. And thank you so much for joining us today, and keep parenting out there. Keep the hope. Thanks so much.
Take care, everybody. Thank
All
you.
right. See you later. Take care, everybody.